What's up, y'all? This is Not a Real Doc DPT, and no, I'm not a real doctor, but I am a doctor of physical therapy that's been licensed and practicing for approximately 12 years now. And today we're going to talk about something that I've been wanting to talk about, but haven't known exactly when to fit it in. And video I just did was talking about differences in different types of therapies. If y'all haven't seen it yet, go ahead and check out that video. Especially if you're not sure what occupational therapy is, then that's the video for you. But that thinking about differences got me to thinking also about something else that is or something that I receive a lot of questions on when I have students that may work with me. And that is, what is really the biggest difference between you as a practicing professional doctor of physical therapy and you as a student physical therapist in a DPT program? And um, that's a great question, and I try to think about I try to put myself in my shoes whenever I have students that work with me. I try to remember what it was like when I was actually a student physical therapist, and I try to relate everything that I'm doing to try to help them along, so it can make that path easier for them. So I wanted to do a video of that and put this out there. Um, so let me start off with some. There is one thing I'm gonna say that is the biggest difference between me as a student versus me now as a practicing doctor of physical therapy. But I'm gonna save that one to the very end. Um, so hold on to then. Uh, but to start off with, I want to get a couple of the obvious ones kind of out of the way. And an obvious difference is going to be I'm obviously now I'm much more skilled in what it is that I'm doing now versus when I was a student. Much more skilled in manual therapy, much more skilled in the exercise treatments that I'm doing, and then relating those conditions or those things that I'm doing to the different patients who may be coming in with a variety of different pathologies and different pain presentations. But I've had a good handle on now the um, the science of what it is that we're actually doing in physical therapy to try to help our patients progress. So that's an obvious one. So obviously I've got more experience. I've done more classes. I've taken more continuing eds, and so all that knowledge that was started as a student has now just deepened. Um, I would say now I am much more comfortable applying that science that I've learned into the art of working with different patient types that may be coming through the door to work with me. Working with we work with everything from, hey, just generalized back pain to patients that have had strokes, to knee replacements, hip replacements, rotator cuff surgeries, balance difficulties, patients that have been having multiple falls, occasional spinal cord patients, occasional amputees, things like that. So the art of physical therapy comes in when you're taking that science that you've learned and then applying that to the different patients that you have, and then trying to help them progress towards their goals and using that to help progress the patient along. So obviously, also I feel much more comfortable with that. Um, I'm also, this is something that they don't tell you about when you're a student, and they don't address it very much. But in most all practices, if you're not working with a Medicare patient, you will be expected to be working with multiple patients at the same time. Usually, it's only two, maybe three. If you're consistently, as a student, if you are hired into a job where you're consistently having to see like 4 and 5 patients at the same time, that's a job where you're kind of in a mill, and you probably want to leave that job as soon as you can. But it's very normal to expect that you would work with 2 or 3 patients at the same time, as long as they're not Medicare. And there's a skill to that. There's a skill to delivering individualized care to a person when you're not seeing them as an individual. So and then there's also a skill not only in that delivery that you're doing, but that in helping to make sure that they do not feel that they are not receiving individualized care. You want them, from their perspective, to feel like, even though you're working with multiple patients, that they're receiving your undivided attention, as needed throughout their entire visit with you. So that's another area where I would say that I'm much improved and much different now from where I was then as a student. Um, Speaking of that, I am also now much better at multitasking, and not only working with those patients and understanding what they're doing, no matter where they are in the clinic, um, and making sure to continue to progress them, keeping an eye on them. But maybe while I'm doing manual therapy with one patient and I'm having two other patients doing exercise, and trying to, keep all of those kind of balls in the air. But then there's also is time management within all that, paying attention to the clock. Who has been here the longest? Who is now, is somebody, did somebody come in late and now you're, they're kind of 15 minutes on, and now you've got someone else that's coming in. So there's definitely a time management aspect to multitasking. Then there's also is, while you're doing all that, performing proper documentation of all those patients while you're doing it, so that you can be efficient in what it is that you're doing. So that is uh, probably one of the more difficult areas to, and one of the more difficult things to get under your belt, as far as getting comfortable with that and doing that. I think some of my friends might still criticize whether or not I am fully have got the documentation piece when I've got all those balls in there at the same time. But they can they can remain in the quiet in the peanut gallery. So yeah, so all of that, all of those are things that are different, and that are I'm improved upon from when I was a student to now being a DPT. But I would say the biggest thing and the main thing that is the difference between where I am here now as a DPT and maybe where you are now as a student DPT, or SPT, is back then when I was a student, what I wanted to make sure of, and the thing that I was most uncomfortable with when I was working with a patient or multiple patients, is understanding that I was doing the correct treatment at the correct time with the correct patient to advance that patient to their goals. I wanted black and white answers, and to, okay, well, how many times do I need to do this particular exercise? How long do I need to do this particular manual therapy treatment in order for me to get positive outcomes for the patient, so that then I can help them and we can heal them up, and then they can return to their life as it was. Um, that manual, it does not exist. And the your professors, your CIs, um, they will provide you with kind of the guidance to try to help move you along in that direction. But the end result, or the thing that no one explicitly states, is we don't know with 100% certainty any of that. We think, based, if you're practicing evidence-based medicine and you've got a good experience with an area, and that, well, if I did this and this with this particular patient, then that kind of tells me that I'm going to make progress. And then when I research this and the different studies I find, they tell me that, if I do this and this along with that, that will help this patient to move on. And then, we know that that's within the framework of what, the patient is wanting to achieve. Yeah, that we all have, we have got that as a generalized understanding of where things should go uh, when you're working with a patient, and how things should progress. But we don't know that with absolute certainty. There is a hazy shade of gray that you're going to find out when you're working with patients. That when you do something in a particular way, you might, do it too aggressively, and you're going to overcook a patient, and now, you're going to have to try to calm down, that nerve that you've now kind of flared up, or, you may work a patient too aggressively, or you may not. You may do it, you may do manual therapy, and you may heal that person up, and, they may have the unusual therapy of where they just respond instantly to your treatments, and then their therapy progresses like in a straight linear fashion, like a rocket ship taking off. And occasionally you'll have those patients, if you'll watch one of my earlier videos about that, about how physical therapy should progress, you can find that earlier in my channel. I talk about that because that is not the norm. But when it does happen, and it will for you, I'm sure, it's awesome. And patients think that you're great. They think that you're the best thing ever, and they'll sing your praises. But did I know with 100% certainty when I was doing that I was going to get to that outcome with 100% certainty? No, I didn't. I I thought it. I thought, yeah, this, when I, based off of, what I've learned, and based off the science, what the science has taught me, based off of what my own experience with patients who had a similar presentation, I had an idea that if I do this, that this will help this patient. But I didn't know that with certainty. And for me, that was the biggest, that I would say that is the biggest difference for me as a physical therapist, that has a doctorate, that's practicing now, that is professional in what I do, compared to back then as a student. It's the thing that was the hardest for me to grasp, is being comfortable, not being certain that what I was doing was going to certain or absolutely lead to that certain outcome that I was looking for. That being comfortable in that uncertainty, that is the biggest difference from me now versus then. Back then, I was very uncomfortable in that area. Now, after 12 years, and it hasn't taken me 12 years. It took me 12 years to get this video together, but it didn't take me 12 years so don't get stressed about that. You will develop this within probably your first year to 2 years. You'll get to where you're comfortable working in that uncertainty. But that's an area that I would say is my biggest difference, and that's what I would recommend to you as a student physical therapist, that you work on or acknowledge, recognize. You're not unusual. You're not, you're not, it's not wrong. It's not, you're not, you don't know less than your other classmates or anything like that. You're, you can have all sorts of questions and uncertainties within yourself, and that, doubts that what you're doing and stuff like that. It's not that. It's just the difference between being where you were there and being where I am now. So, keep working, and, keep studying, learn that all that science. And then as you get experience, you will make that transition yourself. So this is a little different video. Normally my videos are more patient focused. And that's usually is the audience that I'm looking to speak to. But today for this topic, it's something that has been in the back of my mind, because I've gotten this question multiple times from students that have worked with me. So I thought it would be a good idea to have this one video out that's kind of more student focused. Certainly if you're a patient, you can learn from this, and that might tell you a little bit about how, what's in our minds as we're practicing with you. But if you're a student that's watching this and you have any sort of questions for me or anything, please leave a comment. I will be happy to answer you and help you in any way that you can. If you like this video, give me a thumbs up. And if this is the type of content that you would like to hear more of, ask that you would subscribe to this channel. All right, y'all have a good one.